Hi, today I will talk about a very important condition, though rare, but you must know about it, which is known as Hydrops foetalis. What is Hydrops? Now, recently I had a very unfortunate, devastating cases of Hydrops foetalis where I couldn't save the baby, and it has left a permanent scar in my psych. So I'll talk about hydrops today, so you must know about this topic. Now, hydrops are of two types. Immune hydrops, non-immune hydrops. Now, immune hydrops is caused by Rh incompatibility between the mother and the baby. Now, Rh factors, the blood group, each blood group has an Rh factor, positive or negative. So you can have O positive blood, O negative blood, AB positive blood, AB negative blood, like that. If the mother is Rh negative and if she's carrying an Rh positive baby, then there would be a sensitization of the mother. The mother would know about Rh positive, which is very foreign to her system because she's carrying Rh negative blood. And from the next pregnancy onwards, the mother can attack the baby with severe vengeance and cause even the death of the baby. And in these cases, hydrops forms, hydrops foetalis forms, and these hydrops are known as immune hydrops. If you want to know about Rh negative pregnancy, please watch a video which I had posted earlier. What is actually hydrops? What does hydrops means? Hydrops means the accumulation of fluid in the fetal body. It may be in the fetal cavities like inside the lungs, inside the abdomen, or on the skin and subcutaneous tissue. As a whole, the fetus is highly swollen and rigid almost. The hydrops which I delivered recently was so tough and so solid, so much of fluid has extravasated inside the tissues, inside the abdomen, and inside the lungs. It was such a horrific feeling to hold that baby. Normally, the babies are soft and smooth and quite supple, but this was quite a stiff baby, unfortunately. Now, what is non-immune hydrops? Non-immune hydrops are the hydrops caused in the baby, which is not due to blood group, blood Rh factor incompatibility. What are the causes? There can be several causes. There's a huge factors, huge level of factors which can cause non-immune hydrops from different systems of the baby, from the hepatic system, from the skeletal system, or from the lungs, from liver, etc. Many things can contribute. Almost any systemic disorder can contribute to non-immune hydrops. Moreover, if there is any maternal infection, especially torch infections. I'll talk about torch infection in one of the videos in future. Torch is several infections in the mother. These are like the names of these infections are Toxoplasma, Rubella, Cytomegalovirus, and Herpes simplex. And there is another infection, parvovirus 19. Now, B19, parvovirus B19 also can cause hydrops foetalis. Now, these infections, if it occurs in the mother and in this current pregnancy, and if the mother is not immune to these infections, these can lead to non-immune hydrops in the baby. Now, nowadays, these hydrops are easily diagnosed by the ultrasound. In my case, it had developed very, very quickly, suddenly, within a few weeks. So infection is a possible cause which can happen, which may have led to this condition. And the ultrasonologist was quite perfect in diagnosis the hydrops. So this hydrops, when there is hydrops, and especially this accumulation of fluid in the lungs of the baby, then the lung development of the baby is seriously curtailed. If it occurs, this hydrops occurs before 32 weeks, when the lungs are starting to develop in the fetus, and if there is a high pressure system inside the thoracic, in the chest cavity, where the lungs are developing, because of this accumulation of fluid, then the lungs are not developed properly, and the condition is more or less fatal, and you lose most of the babies. After 32 weeks, if it occurs late and you deliver early and you drain the fluid from the baby, then the chances of success, or the chances of the baby living, is much more. Now, along with this non-immune hydrops, normally which happens to the mother is excessive of water in the mother's pregnancy sac. This is known as polyhydramnios. Normally the baby swallows about 500 milliliter of water every day. Now, when there is accumulation of water in the chest cavity of the baby, it produces such a tremendous pressure in the chest cavity, the baby cannot swallow this fluid. And because the baby cannot swallow, the accumulation of water is increased. Excess accumulation of water can also occur because of the disorder, the systemic disorder the baby is having. In these cases, the mother, because of this excess water, go into preterm labor. There can be a serious condition which can develop in the mother, which is known as abruptio placentae. The placenta, because of this huge pressure, the placenta may start separating from the wall of the womb, and it can lead to severe hemorrhage inside the muscle of the womb, muscle of the uterus, which can lead to a condition, very serious condition in the mother, which is called Cuvelia uterus. And in these conditions, when there is abruptio placentae, placental abruption, Cuvelia uterus, whichever stage it is, there can be acute abdominal pain in the mother. So in these cases, the doctor and the patient must be very, very vigilant and must inform the doctor immediately. Now, can we finally find out the cause of the non-immune hydrops? Most often, we don't find a cause. We cannot find exact cause why this has happened. Even where in the countries where the fetal postmortem is done, the baby's postmortem is done, that service is available, they cannot find always the exact cause of the non-immune hydrops. The good news is, this is a rare condition. This rarely happens. But there can be recurrences, but the recurrences again are rare, but there are few cases which has been reported where there are recurrences, and there especially a case was reported in the literature, in the medical literature, that this mother had 3 successive non-immune hydrops. But again, the good news is that the chances of these hydrops, non-immune hydrops, occurring again and again in the pregnancy is extremely rare. So this is about non-immune hydrops. If you want to ask any question, please do so. I would like to answer him. If you like this video, please like it. And if you want to know about these conditions, please just shoot any question below and I will love to answer. Bye. Take care.